Good evening, everyone. This is Meldita and I'm back. So this is a continuation of our pulseless electrical activity. So PEA has electrical activity but has no mechanical activity. So we have a heart here. So the heart muscle, its valves and their accessories, they need blood supply from our coronary arteries to survive. Okay, so these coronary arteries and their branches will deliver blood to our heart. Okay, so here, when we speak about mechanical activity here, this involves contraction, that is your systole, and relaxation, your diastole. So, a brief review, during diastole, dirty blood from the right side of the body will enter our right atrium. Clean blood from the lungs will enter our left atrium. Okay? And there will be a rise of pressure of blood in the atria. And they will push open our AV valves, the tricuspid and the mitral valve. Okay? So blood will fill up our ventricles. So as the blood fills up the ventricles, there will be a rise of pressure of blood. Okay? And then they will shut off or close the AV valves, tricuspid and the mitral. So the closure of the first valves is called our S1. That's the first sound, S1 or the lub. Okay, and this is the actual systole here. So there is a continuous rise of pressure of blood in the ventricles. So the right ventricle will open the pulmonic valve and delivers the blood from the right ventricle to the pulmonary artery. And there will be a continuous rise of pressure of blood in the left ventricle and opens the aortic valve and delivers the blood to the aorta. The opening of the aortic valve and the exit of blood to the aorta is called now your systolic pressure. So it's like a fraction. This blood pressure is like a fraction. Okay? So the first number here is your systolic pressure. Okay. Okay, so somehow in the pre-diastolic period, so as the pressure of blood in the pulmonary artery in the aorta continues to rise, this will shut off our semilunar valves or our pulmonic and aortic valve. So that is our second sound called the S2 or the dub. The closure of your aortic valve will actually be your diastolic pressure, which is 60. Okay. So making this more simple, because if a patient goes into PEA, we have a rhythm, okay? But we get a problem with the pulse and everything. So, if the heart has a good contraction, okay, we will have a good heart rate and pulse, blood pressure, and cardiac output. So, the heart rate and the pulse, you can feel them with your fingers. You can hear them with your stethoscope, or you can see them on the cardiac monitor screen. For the blood pressure, you can only feel the systolic number, but not the diastolic number. But you can also see the non-invasive pressure, art line, things like that, on the screen monitor. Okay. So, I just have to mention to you that in the diastolic part in here, not all of the blood will get into the aorta. Just to let you know, the left ventricle, there is a normal ejection fraction of blood that the left ventricle will push to the aorta, like about 60 to 80% or 55 to 75%. These ventricles will not be totally empty of blood. There's still a portion of blood left in the ventricles. So we have a certain ejection fraction that the left ventricle will eject. Okay? Will eject from the left ventricle. Okay. So, if we have somebody on PEA, we have an ECG, but we don't have a pulse, and we have no blood pressure, so we will call a code. Okay, so the last topic now will be PEA. Okay? And that's about it. Thank you so much.